What's up, guys? How's it going? K More Muscle, and today we're going to be talking about influenza or the flu. Guys, the flu is basically there's a stomach flu, which is from a virus, and it can cause diarrhea and vomiting. Most people with the flu, they get better on their own, but sometimes influenza and its complications can be deadly. You can get an annual flu shot. And flu season usually runs between October and May in North America. So those colder months are where the flu can be spread easier, right? Guys, some risk factors of the flu include older or younger age. So under 2 or over 65, you're at increased risk for the flu. Being around a lot of people can increase your risk for the flu. Being social is a great thing, but also being around a lot of people or people that are sick, working in the hospital, you're at increased risk for that flu. Weak immune system, chronic illness, certain races or ethnicities can get you a higher risk for the flu, and pregnancy. Guys, when you're pregnant, your body is forming a baby and is gonna, take those nutrients that normally you would have and be giving it to your baby. So you're gonna be weaker. Your body's gonna be weaker at that time because of all the work it's doing. And also a BMI over 40, you have increased risk for flu complications. Okay, let's get down to it. Some symptoms include fever, cough, muscle aches, feeling very tired or fatigue, sweating and chills, nasal mucosa, dry throat, photophobia, which is light sensitivity, myalgia, muscle pain in one or more of the muscles, and some complications include respiratory distress, muscle damage, worsening of chronic disease. So say, for example, if you have asthma already or you have some type of respiratory disease, when you get the flu, that can make it worse. So that's something you want to basically you want to be aware of that. Some lab tests you can do is the viral culture or fluorescent antibody staining. That's just going to allow medical professionals to know if you have the flu. Some nursing care procedures is you want to promote fluid intake, rest, and acetaminophen or ibuprofen can help with the fever. And then medications would include the influenza vaccine. So this is recommended for children over the 6 months of age every year. Guys, there's a lot of false information about vaccines, but vaccines are definitely positive for this world, and they have helped and saved tons of lives that we don't even know about. A lot of people will get them, influenza or the flu, and then they'll get the vaccine the next week, and they'll think because of the vaccine they got the flu. So there's a lot of false things that occur from vaccines. But I promise you guys, vaccines are very safe. They increase people's livelihood and they help people live longer, and they're definitely a blessing. But there are some contraindications where it would not be smart for you to take the influenza vaccine. People that have heart disease, lung disease, diabetes, kidney failure, or are immunocompromised, or are pregnant, should not take these vaccines. Also, if they have a severe allergy to eggs, you should not take this vaccine because that is how the vaccine is made. So if you have an allergy to eggs, you do not take this vaccine, the influenza vaccine or the flu vaccine. Or if you have a history of Guillain-Barré syndrome. So basically, if you are immunocompromised, you do not want to take this, guys. When you're pregnant, sadly, you're not as strong as normal, so you are immunocompromised in a way. Some other medications include amantadine, and that shortens the length of illness. Rimetadine treats manifestations. Zanamivir can treat influenza, and it's inhaled twice a day. Oseltamivir decreases manifestations. All those medications can help, very hard to pronounce. And you obviously want to talk to a doctor or a medical professional before taking these. You want to make sure you don't have any allergies to these medications, and you want to make sure it works right with you. And obviously you want to follow the instructions when you take these medications. And according to ourworldindata.org, globally, seasonal influenza kills around 700,000 people each year from respiratory disease or cardiovascular disease. And during large flu pandemics, influenza strains have evolved substantially, and the death toll can be higher. Guys, a lot of these people are older and they're already of old age and they die from the flu. But this is still something very serious. The influenza vaccine can definitely help you. And remember, do not take if you're immunocompromised or you have an allergy to eggs, or if you have any of those other things I listed. But this is serious. People do die from this every year. And some people just say, oh, it's just the flu. And for people that are healthy, it is just the flu and your body's going to get rid of it quickly. But people that are immunocompromised, that can be a problem. And especially, guys, if you have something like asthma or you have some other chronic disease, you really need to take care of your health, because if you want to give your body the maximum strength it has, just in case you do get the flu, which will make that chronic disease worse. Anyways, guys, thanks for watching. Hopefully you learned something about the flu. Reminder, the flu vaccine is very important and it can help a lot. So thanks for watching, guys. Subscribe.